the treatment plan was discussed within the heart failure team and ultimately came back that we were going to simply hold diuretics for the rest of the day and to reassess the next morning.
Yeah. And honestly, if she was towards the end of her diuretic treatment, if they already pulled off the sufficient volume, that probably was the best choice, right? If they did their job, then stop them if they're causing a problem. But some patients, they did their job on the vascular side, but there's still a lot of fluid that has to come off from the extravascular side. So we would keep the diuretics going. It just kind of depends on the patient and all the factors that go with each specific and unique patient. And so the hope is when her pH corrects itself, because there's no longer the contraction alkalosis, so the pH comes down, then the body no longer compensates by hypoventilating. And so the CO2 will also correct. Now she can actually blow off that CO2 and her mentation will improve, right? Which you didn't get to have her back a third day. That would be like a miracle for a float nurse to have patient 3 days in a row. But I'm sure the next day, once her pH had corrected, she was back to her normal self, walking and talking and feeling much better.
And I know, while I didn't have her back for a third day, I know that she did discharge shortly after. So she did pull around and was stable enough to go home.